Well,
Right.
hello. Oh, go ahead.
I was just going to say hello. Thank you so much for attending. This is the Emergency Nurse Practitioner virtual open house. We're very happy that you all are here, and hopefully you get all the information that you need. My name is Ashley Chilla. I may have frozen, but I'm still here. There we go. I'm the Associate Director of Admission here at Emory School of Nursing. We have Michael Walker, who's one of my coworkers, colleagues, and he's the Director of Admission for the DNP programs. And I'm going to turn it right over to Dr. Paula Tucker, who is the program director for the Emergency Nurse Practitioner program.
Awesome. Well, thank you so much, Ashley, and to Michael for facilitating this virtual open house session. And welcome to all of you who've joined today. I'm excited to share with you more about the Emergency NP program. So, we're going to go ahead and get started. I do have a slide deck, which will help keep me on track and make sure that I don't miss any pertinent information pertaining to the program. If once I'm done, I would love to entertain questions as well. And this will be made available online, I guess, through YouTube. So please don't hesitate to reach out if there's something you need a little bit more clarification on. So, welcome. I am going to share my screen. Give me just a second here. Let's see, share. Okay, does that look good, Ashley? Okay, I'm seeing a lot of other things here.
Looks great from here.
It does? Okay,
Yes.
let me move this over. Okay, so that I can see my screen here. Oh, okay, great. Well, most of you know that I am Dr. Paula Tucker, and I am the specialty director for the Emergency NP program. I would like to just briefly share with you my clinical and scholarly experience. I am a graduate of this program, so the information I'm sharing with you comes from personal experience. After I completed this program, I started working at the School of Nursing in this program in 2015. I currently practice within an emergency department, our level one trauma center, which is Grady Memorial Hospital, in the emergency department. And my scholarly interest pertains a lot to quality improvement and implementation science. But before I share with you about the Emory's EMP program, I would like to provide an understanding of emergency care and the role of the ENP. I think it's very important that we start out with this. Emergency care is not defined as a setting. Oftentimes, we think about the emergency care as only pertaining to the emergency department, but rather it is a practice that is delivered in diverse settings. And a lot of this is including but not limited to, again, the emergency department, but it also includes urgent care clinics, the emergency department clinical decision observation unit. Some of you may be familiar with that particular model to decrease admissions and hospital readmissions and emergency department readmissions. It also includes emergency medical response vehicles. Telehealth is becoming very popular. Disaster locations, that is part of the emergency role as well, and even correctional facilities, even some occupational health centers. So, emergency care is very unique. It's a specialty practice that encompasses the evaluation, management, and treatment of patients who experience an unexpected illness or injury or varying complexity. I do want to highlight that 68% of patients across the lifespan. And what I mean by lifespan, I mean those patients who include from the cradle all the way to the grave. Okay. Those patients who present to the emergency department across the lifespan often have these primary care problems. And so the foundational academic preparation as a family nurse practitioner who's prepared to care for patients of all ages with additional training in the management of patients with life-threatening and urgent conditions is the most appropriate preparation for practice in terms of being an emergency NP. Okay. So some of you may be asking, well, what about the acute care nurse practitioner? And what is that association with emergency care? Now, there are acute care NPs who do practice in emergency care settings. However, these nurse practitioners have a very limited scope of practice based on patient age. Okay. So, therefore, acute care NPs are not prepared to work across most other emergency care settings. And in the same, FNPs are not prepared to work across emergency care settings because they do not train in acute resuscitation and stabilizations of patients with life-threatening conditions. Okay, moving on to the next slide. Let's see, why is it not moving here? Okay, all right. So, um, let's see here. So let's talk a little bit about, I think I went to slide. All right, I think you can see this. So what are EMPs prepared to do? All right, let me move here. So, emergency nurse practitioners are prepared to provide care to patients of all ages, ranging from acute resuscitation and stabilization of life-threatening health problems to management of minor injuries and illnesses. So, the role of the ENP mainly consists of medical screening, decision making and managing patients, including specific emergent and urgent care procedures such as 12 lead EKG interpretation, even radiology interpretation. We do a lot of wound management, foreign body removals, and also basic ortho procedures such as splinting and doing reductions and arthrocentesis. Um, and even resuscitative procedures like chest tube insertions, vascular access, and airway management. So, this role encompasses uh, resuscitation and stabilization, and these patients often present with life-threatening conditions. Now, just a little bit of facts here. As you can see, there are about 325,000, and I think this number has certainly increased, that are practicing in the United States, nurse practitioners. And this data came from the American Association of Nurse Practitioners. 69% of NPs are FNPs, so very popular, very common practice. About 20,000 are working in the emergency department, and 96% of nurse practitioners who are working in the emergency department are F&Ps, okay? 90% work with patients across, acuity levels, and about as of right now, I think we probably have about 15 graduate EMP programs across the country. Now, in 2014, the American Academy of Emergency Nurse Practitioners was established, and this is the organization that essentially regulates education and practice for ENPs. This number has certainly risen, but as of January 2017, we now have a certification exam. Okay, and this essentially is a actual exam. It is not a portfolio. We used to have a portfolio like a written exam, but now we have an actual test exam. And this exam is deployed through AANPCB. Okay. And right now, we probably have close to about 1,200 certified emergency NPs. Now, I do want to also talk about the demographics and what you'll most likely see um, within the emergency department or within emergency care. A large percent are going to be females. And so women between the ages of 15 and 64 are the third most common reasons that present to the emergency department, particularly complications with pregnancy and those who are within childbirth years. 22% of those patients are pediatrics. And this is what we mean by this role really encompasses caring for patients across the lifespan because we start at the ages of 0 to 4 and on up into even the geriatric or older adult population. Now, 82 to 90% of these patients that present to the emergency department are going to be managed and essentially or subsequently discharged home. Okay. And about 15 to 20% are going to be admitted. All right. And then when we think about the triage level or the acuity level, most are going to be about 31% that are triaged as level 3. So I think, having some understanding about this particular data is important because it really highlights the types of patients you're going to see within this role and why it's important to have the family NP as the educational preparation and foundation to the emergency NP specialty education as well. Now, this is our consensus model, and this is essentially a model that describes what we are. And as of right now, as you can see here at the bottom, you have the nurse practitioner role. But then as you progress into that role, we break into populations. And so right now, this training is built upon the family population. That's why you're required to obtain the family NP. On top of that education, there is what we call specialty training, and the EMP is right now considered a specialty education training. Okay. All right. So now, since I provided an overview of the role of the EMP, I really am excited to share with you about our EMP program here at Emory. Now, this program was established in December 2002 through funding by the Bureau of Health Professions, Health Resources, and Services Administration. And it was through this funding that the EMP program successfully joined the Emory School of Medicine Department of Emergency Medicine to create this interdisciplinary academic partnership to specifically train EMPs with emergency physicians. And this is really a highlight of our program. We truly believe in interprofessional education and training. And so I think this is what makes our program very unique because we have this relationship that has been built over many years. A lot of our students have the opportunity to train and work with some of the leading experts in emergency care. And so since this establishment, we've probably had close to 400 students who've graduated from the program and are currently working as NPs throughout the country in a variety of emergency care settings. So I do want to highlight a key component of our EMP program that sets us apart from other EMP programs across the country. Now, as a result of this partnership, with the Emory School of Medicine, Department of Emergency Medicine, our curriculum and training is based on this interdisciplinary model where our students, again, will train with some of the residents as well as learn from a lot of the emergency medicine physicians to build competency in team-based care. And so we truly believe this clinical training model is crucial to the role and significant to the ENP. Okay, so let's talk about the evolving role of the emergency nurse practitioner. I would like to highlight specific emergency care settings in which the EMP is prepared to practice. And so EMPs, again, provide rapid evaluation and initiation of care in emergency department treatment settings and also pre-hospital settings. And so here we have our prior EMP director, Dr. Evans, who is precepting one of our EMP alums at one of our clinical hospital settings. And this particular alum now owns her own urgent care practice. So, as I mentioned before, once you have this education and training, I believe it opens doors for many different ways you can provide care within emergency care settings. EMPs are also prepared to work in emergency department fast track zones as well as urgent care clinics. And so here are two of our Emory EMP alums working in an urgent care center out in Portland, Oregon. Now, this is a very unique model that we're seeing a lot of increase in utilization. It's mobile integrated healthcare teams. And this represents an emerging innovative care model where EMPs provide urgent care or emergency care in a patient's home supported by a paramedic. And these teams provide care for lower acuity problems, which include wound repair, administering IV fluids, medication management. And these particular I would say treatments help to reduce unnecessary ED visits. This model is certainly increasing due to its cost effectiveness as well as patient satisfaction. And so our EMP students have the opportunity to complete rotations using this model as well. So very, very cost-effective model, and I'm really excited about how this model is again decreasing emergency department visits, and we're able to provide that emergency care in the comfort of patients' home. Another emerging care model is utilization of telehealth to facilitate emergency care across these diverse settings. And that could include emergency departments, our observation units. And what we're seeing is that this will allow us to care for patients who are mainly in the rural and critical access settings. Now, one of the first clinical rotations our students complete within the program is working in our emergency department observation units. And so, this opportunity for our students really provides an understanding of how we provide care to emergency department patients who are admitted for these time limited workups. And so, this is essentially protocol driven, but what we're finding is that it's cost effective and it's a way to reduce hospital admissions, even ED readmissions, and essentially improving overall patient outcomes. So while EMPs may work autonomously, providing care to patients who present with lower acuity problems, EMPs are also prepared to manage patients who require higher levels of care. And so I do want to emphasize that working in high acuity and trauma areas within the emergency department is not a independent role, but it's rather a team-based care that is led by an emergency department physician. Now, one of the highlights of our EMP program is the opportunity to obtain about 200 clinical hours at our level one trauma center here in Atlanta, Grady Memorial Hospital. And this is just an amazing clinical opportunity for our students. They learn so much, and it's great that they can work with emergency medicine residents and other APPs, PA students, medical students. It's just a great environment to facilitate that interprofessional collaboration and training. This is one of our strongest clinical partners and what really attracts our students to this program. Now, disaster preparedness and response is also a component of emergency care. And so EMPs are required to be on the front lines when a disaster occurs because it will occur. And so a required disaster preparedness and response course has been integrated within our program to prepare students for such a role. And we have an amazing time, and we're able to bring in experts across the department to educate our students and have some exciting skills lab. Now, as healthcare is shifting and patient populations are aging, being able to access emergency care, particularly within rural communities, is limited. And so we prepare ENPs to care for older adults and to work in rural emergency departments where we're seeing these workforce gaps exist, and often this lack of knowledge. And so what we're finding is that the use of telehealth, as well as mobile integrated health care teams are essential to creating an opportunity to provide care in these settings. Now, in addition to the prerequisites for admission into the Emory's EMP program, our curriculum focuses on preparing EMPs as clinical experts and leaders through this 7 semester integrated doctorate of nursing practice degree. So you might ask, why is it necessary to have a DNP? And as I mentioned, healthcare is constantly changing and emergency care is evolving. And so the role and practice of EMP is critical in leading and translating safe, evidence-based, high-quality care within the microsystem of emergency care. And we believe the Doctor of Nursing Practice education provides these skills and competencies within this ever-changing, complex healthcare system. Now, in addition to the required DMP project, that you'll have to complete and the program hours, the DNP ENP student will be required to complete a total of 11, I think 1100, close to 1100 clinical hours. And so that's going to be 500 primary care hours. And these settings are particularly going to be in family and urgent care settings, and then 640 dedicated emergency department hours. And we have several rotations that encompasses emergency care, urgent care, radiology, our Grady Emergency Care Center, which is our level 1 trauma center in Atlanta, and other Emory affiliated academic community EDs. Now, we also understand that we attract students who are out of state, and we have an amazing clinical placement office that can help facilitate and get students prepared for their clinical rotations wherever they may be located. But this is just particularly for those who are residing here in Atlanta. We try to keep these clinical partners, these relationships available because they provide some great experience. So the ENP DNP program is extremely rigorous, and it does not have, I don't think it may have a part-time option, but I don't think it does, but I would have to check back. But we we certainly want to let students know that it is an amazing opportunity to advance your education and hopefully become an amazing ENP. Now, I want to talk a little bit about some of our procedural skills training. Uh, Certainly, as I mentioned, advanced airway is certainly unique to our role as well. Here you can see one of our students learning lumbar puncture. These are, and all these are our alums here. Um, and then, of course, certainly have opportunities to learn how to catch babies, precipitous deliveries, which is also a clinical training skill that EMPs are required to know. We also have opportunities for service learning, which is also a highlight of our program. And I always encourage students to take these opportunities, particularly going down to Moultrie for our farm workers experience, as well as other opportunities outside of the country. We do a lot of simulated training, which is really amazing. And we have an amazing simulation center that allows us to do that. So this is certainly an opportunity to learn how to take the knowledge and apply it to practice in a safe learning environment. We also have in-class simulations as well. Um, and then also, I want to close out and just highlight some of our professional organizations that I feel are important to the EMP role. We have the American Academy of Emergency Nurse Practitioners, as well as the American Association of Nurse Practitioners and Emergency Nurses Association. And each of these organizations have student memberships at a reduced cost, but a lot of educational content to prepare our students. And a lot of our faculty are members of these organizations and have leadership positions. So I think we are now um, done with this. Concludes the overview of the EMP program. I certainly want to thank you for your interest. And please don't hesitate to reach out if you have any further questions. I'm going to now stop sharing and turn it over for any questions. I see we do have some uh, questions in the chat, do we? Okay, so thank you, Mr. Walker. We do offer a part-time option. Thank you so much for clarifying that. Any questions? I know that was a lot of information to digest, but if you choose to watch this recording and you have questions, please reach out to our admissions department and they will certainly relay the information to me as well. Okay, we do have a question. Angelina. Hi, Angelina. Thanks for joining us today.
Hi, thank you so much. My question is, out of the 640 clinical hours that are dedicated to emergency care, are there any that will be done at like a pediatric emergency department?
Yeah, only a few, not a large amount, but certainly we have opportunities for students to complete some direct pediatric emergency um, department hours, clinical hours. That's a great question.
Okay, thank you.
You're welcome. Okay, so we do have another question in the chat. Um, from Julia asking, does Emory provide clinical placements or is it the student's responsibility to find preceptors? So that's a great question. It is yes and no, right? So depending on um, if you decide to remain here in the Atlanta metro area, we do have some available placements for our students. And then we do require that if students have some relationships, clinical relationships, and have maybe some preceptors they're interested in working with, we can certainly help to facilitate and get that process started for students. So it is a very dynamic process, and we do have resources in place to help students be able to complete those hours. And Michael and Ashley, please uh, um, join in if there's something I'm missing, but I think that is the answer.
Yeah, I was gonna say that was a beautiful answer.
Yeah.
There is a support system here in place if you do need assistance, but you'd really think of it as a partnership as opposed to us saying, here's your clinical placement. And so there is some legwork that you'll do in your part. I did put a link just so you can kind of see the work that our clinical placement does with our students. So there's lots of wonderful resources. You will not be able to quickly scan. I would say take some time and look at it. Uh, but certainly you want to bring your experience, your context to bear during as a part of this process.
Thank you, Michael. Great question. Any more questions? Well, I guess it was informative. Like I said, if you watch this recording again or have questions afterwards, please reach out and we can certainly be able to answer those for you. Well, I want to thank you all for joining today. Um, and I wish you all the best in your educational journey. And till we meet again.
Thank you so much, Dr. Tucker. Like she said, if you have any questions and you need any clarification on anything, whether that is the admissions process, the application process, or questions about the program, you can always reach out to the admission office, which our email is nursingquestions@emory.edu. Michael has put his email in there as well. And we can either get the answers you need or direct you to the correct place to find the answers you need. So thank you again for joining us. We will be sending you this recording so you all can go back over it if you need. Thanks so much.
Bye.